Do you take metformin or know someone who does? Or maybe you've heard of the well-known glyphage. Today, we're going to have a clear and human conversation about what no one tells you at the doctor's office when it comes to metformin. A detail that can make all the difference between a medicine that helps and a choice that delays your health progress. And look, it doesn't matter if you've been taking it for years or are just thinking about starting. The next few minutes might completely change how you see this little pill that's so common in the daily life of people with diabetes or prediabetes. Stay with me until the end because besides important warnings, you're going to find out how metformin really works, who should or shouldn't take it, the most ignored side effects, and even when it can be dangerous. What you're about to hear doesn't replace medical advice, but it will definitely prepare you to have better conversations with your doctor and make safer decisions. Today, metformin is one of the most prescribed medications in the world for managing type 2 diabetes. And the reason is clear. It acts directly on the liver, helping to reduce glucose production in the organ. In other words, it controls blood sugar without depending on insulin. That's especially useful for people with insulin resistance, which is very common in those with type 2 diabetes. On top of that, it improves how sensitive your cells are to insulin, allowing your body to make better use of the hormone it already produces. The result? Less glucose floating around in your bloodstream and fewer blood sugar spikes throughout the day. It's a simple mechanism, but highly effective. But that's not all. Metformin also affects how your body absorbs carbohydrates in the gut, slightly reducing the amount of sugar that enters your blood after meals. As a bonus effect, it often leads to modest weight loss in many patients, which is a very welcome benefit for those who are overweight and have type 2 diabetes. Some studies even suggest that metformin may help reduce the risk of certain types of cancer, such as prostate, breast, and colorectal cancer. While these studies are promising, more research is needed to confirm this protective effect. And all this comes at a relatively low cost and easy access. Sounds almost like a magic pill, doesn't it? But that's where the danger lies. Because even though it's effective, it has its limitations, side effects, and it's not suitable for everyone. And if you don't know that, you could end up suffering in silence, thinking it's normal to feel unwell during treatment. But we'll get to that in a minute. First, it's important to understand who are the ideal candidates for metformin. In general, it's adults diagnosed with type 2 diabetes, especially those who are at the early stages of the disease and still produce insulin. It's also widely used for people with prediabetes as a way to prevent the condition from progressing. Additionally, it's prescribed for people with polycystic ovary syndrome, PCOS, since insulin resistance plays a big role in that condition. And in many cases, metformin can be the first step before more intense medications or even insulin therapy. It often works well on its own, as long as the person also changes their eating habits, exercises, and keeps up with regular health checkups. Because, let's be honest, no pill works miracles if your lifestyle keeps sabotaging your body. But who shouldn't take metformin? Or better yet, who should avoid it at all costs? There are cases where this medication, despite being popular, can be risky. One of the main concerns is with people who have moderate to severe kidney problems. That's because metformin is eliminated through the kidneys, and if they're not working properly, the medication can build up in the body and cause a dangerous condition called lactic acidosis, a serious chemical imbalance that can even be fatal. People with liver problems, uncontrolled heart failure, severe infections, or those who are fasting for long periods should also avoid it. And watch out if you're getting a test with contrast dye. In those cases, you need to temporarily stop metformin, since contrast can strain the kidneys. In short, if you fit into any of these categories, metformin might be more of a risk than a solution. And even for those who can take it, there's something most people ignore: the side effects. They're common and can be very uncomfortable. The most frequently reported issue is gastrointestinal discomfort. Many people experience nausea, cramps, gas, diarrhea, or even a loss of appetite in the first few days. Sometimes, this goes away as the body adjusts. But in other cases, the symptoms are so intense that people give up on treatment. And that's where a big mistake happens. Stopping the medication on your own, without guidance, only makes diabetes harder to control and increases the risk of long-term complications. The good news is there are ways to deal with these side effects. The first tip is simple. Never take metformin on an empty stomach. Always take it with a meal, preferably something substantial. That alone helps a lot. Another strategy is to use the extended release version like Lifesaver XR. It's absorbed more slowly and causes less irritation in the digestive tract. And of course, starting with a low dose and increasing it gradually helps too. Your body needs time to adapt. And if even with all that the symptoms are unbearable, there are other medications your doctor can consider. The key is, don't suffer in silence and don't abandon treatment without guidance. Here's an interesting fact. Did you know metformin can interfere with vitamin B12 absorption? That's right. With long-term use, especially in older adults, this medication can lower B12 levels, a crucial vitamin. B12 deficiency is linked to tingling in the hands and feet, extreme fatigue, mood changes, and even memory loss. That's why anyone using metformin for long periods should get regular blood tests and supplement if necessary. It may seem like a small detail, but it can save you a lot of trouble later on. And there's more. Even though it's rare, the risk of lactic acidosis needs to be taken seriously. This complication can occur when metformin builds up in the body, especially in people with poor kidney function. Symptoms include rapid breathing, extreme weakness, muscle pain, dizziness, and stomach discomfort. It's a medical emergency and requires immediate attention. So never ignore strong or persistent symptoms if you're on this medication. Knowledge saves lives. Now, let's talk about metformin in the context of insulin resistance. This condition is becoming more and more common even in people who aren't diabetic. When your body produces insulin, but your cells don't respond properly, the pancreas has to work overtime. Over time, this leads to exhaustion of the organ and rising blood sugar levels. Metformin acts as a silent regulator here. It improves insulin sensitivity, reduces glucose production in the liver, and takes some pressure off the pancreas. This helps not only to manage diabetes, but also to prevent it in those on the edge. That's actually why many doctors prescribe metformin to people with prediabetes. Studies show it can delay and sometimes even prevent the progression to type 2 diabetes in people with high fasting glucose or a family history of the disease. But as always, medication alone isn't enough. Real lifestyle changes must go hand in hand. Otherwise, what you gain from the medication is lost to poor eating habits and a sedentary routine. A very common question is, what if I'm taking metformin, but my blood sugar is still high? That can happen for several reasons. The most common is poor dietary control. Metformin helps, but it can't handle constant overloads of refined carbs, sugary treats, white bread, and processed foods. Another factor is lack of physical activity. If you don't move, your cells don't use glucose efficiently, and it just piles up in the bloodstream. And of course, it might be time to adjust the dosage or add another medication. So, if your glucose levels aren't improving with metformin, the answer isn't to give up, it's to investigate. At this point, many people ask, but if metformin makes me feel sick, am I forced to keep taking it? And the answer is no. There are alternatives. Today, we have several classes of medications for blood sugar control, like SGLT2 inhibitors, GLP-1 agonists, and others that work in different ways. Some of them even promote weight loss and heart protection, being ideal for specific cases. But a heads up, they're more expensive and have different side effect profiles. That's why any change should be guided by your doctor. Metformin is one of the most well-studied and widely used medications in the world. Is it safe? Yes, in most cases. Effective? Also yes, but it needs to be used with care, monitoring, and responsibility. Just because it's common doesn't mean it's harmless. And more importantly, the patient needs to understand what they're taking and why. Enough of that, just take this and don't ask questions approach. Quality information, like what you're getting now, transforms treatment and gives people with diabetes or insulin resistance more control over their own health. If this content helped you in any way, share it with someone who needs to hear it. A lot of people suffer from side effects or are afraid to start treatment simply because no one explained it clearly. Sometimes, the right piece of information at the right time changes everything. And if you still have questions, leave a comment. We read everything and respond with care. Don't forget to like the video, subscribe to the channel, and turn on the notification bell so you don't miss the next videos. And remember, your treatment starts with knowledge. See you in the next video. Take care.